Hi, this is pharmacist Curtis Alexander. In this video, we're going to talk about the medication Gocovri. This is part of our 101 series where about a 5, 6, 7 minute video where we just cover like a 35,000 foot overview of the medication so you can discuss it, understand more of it with your doctor and what you might expect. Real quick, appreciate a thumbs up if this video was helpful. Also subscribe to the channel. I'll have other videos about medication, supplements, all from a pharmacist perspective. So just hopping right into it. So Gocovri is a medication that is used to treat movement problems. If somebody has Parkinson's disease and they have movement problems, which are called dyskinesias, and they can present different ways. They can present as rigidity. They can also present, you'll see people with Parkinson's and their arm is moving rhythmically. So that's a dyskinesia. But it has to be somebody who has Parkinson's disease and they're on a levodopa type therapy. And usually that's going to be something like Sinemet, which is a very common Parkinson's therapy. What happens is over time these people are on this levodopa therapy and these dyskinesias can pop up. Now, Gocovri is actually like an extended release formulation of amantadine. Now, they've used amantadine in the past because amantadine is available as a generic and an immediate release, but they haven't had that good of results with it. They do see better results with this extended release formulation of Gocovri. Now, interestingly, if you want to know how it works in the body, we really don't know. We used to think that it was related to dopamine in the body, and we're starting to believe that that may not be the case. We're kind of looking at a chemical called NMDA and those receptors. Again, not sure at this point how it works. How a medication gets approved where we don't know how it works, can't totally answer that, but we do know that this helps people. So as far as the dosing is entirely related and dependent upon your kidney function. So the doctor will take your labs and they'll get an idea of what's called your creatinine clearance, which is basically a measurement of how well your kidneys are functioning, how fast they can clear fluid from the body, basically. So in somebody who has a creatinine clearance of less than 15 milliliters per minute, that's severe kidney disease. You cannot use Gocovri because it's eliminated through your kidneys, so it will build up too fast. We just can't use it in those people. The next segment is if your measurement is 16 to 29 milliliters per minute. We would dose that person at 68.5 milligrams per day, and that's actually a bedtime dose. The next subset is if your creatinine clearance is 30 to 59 mils per minute. We'll start those people at 68.5, and they can go up. They don't have to. They can go up to 137 milligrams at bedtime. And the last group is going to be this 60 to 89. If you're in that range, they will start you out in 137 milligrams at bedtime. Do that for 7 days, and they're going to bump you up to the 274 milligrams. So again, your dose is entirely dependent on your kidney function, so they have to know that first. Now let's get into the side effects. By far, it's actually not by far, but the most common one tends to be dizziness and feigning. Again, I want to point out, I have 29% there. That doesn't mean that's an absolute number. It just means that up to 29% of people in studies experienced it. It depended on the study, but it's a decent chunk of people that can see the dizziness, can see the feigning. So obviously we want to be very careful in elderly patients, anybody with any sort of blood pressure issues when they're standing up, really want to watch those folks. The next most common one, again, up to 25% of people in studies had delusions and even paranoia. So something to keep an eye on there. Peripheral edema was kind of a wide range, 1 to 16%. So take that for what it's worth. Dry mouth, again, a wide range, anywhere from 1 to 16%. Then we have constipation, also 1 to 13%. But the two biggest ones, obviously, are going to be your dizziness and delusions. Now, I had a chance to speak with one of the representatives for my particular region for Gocovri, and if you need to get Gocovri, one of the downsides, and to me it's a big downside, but this is my personal take, is that you are going to be required to go through. Gocovri has essentially a deal with Accredo specialty pharmacy. I believe it's Accredo. So you can only get it through them. They're really difficult to deal with. I'm not a fan of their customer service, but obviously if you're in this situation where you need Gocovri, you're going to have to go with them. But sad face to me is I just don't think that's a good setup for patients, but it's what you're going to be faced with if you decide to go that route. The other thing that we want to talk about is the cost. It's an expensive medication. It's a specialty medication. The drug company does offer financial assistance. I will include a link to that. But just know there's going to be some hurdles to overcome if you and your doctor decide this is the next step for you and something you want to move towards. So again, that's my thoughts on Gocovri. So I appreciate you watching. If you know anybody who's used this, if you've used it yourself, please comment below. I'd appreciate your feedback. So again, Curtis Alexander, I'm a pharmacist. I appreciate you watching the video. Thanks.